We talk today about screening, title and abstract screening using Rayyan website. If you have account, just sign in. If no, just sign up. After that, the invitation from the leader will come to you for screening. Actually, mostly we use the screening by two independent reviewer, sometime three, sometime more, but at least two independent reviewer. So blind screening. This is two reviewer blinded. No one know what the other reviewer chose. So let's start here. This is the first vagus nerve stimulation and cardiovascular system. As you see from the title, this is excluded. How we screen for each article, we apply our B code: population, intervention, comparison, outcome, and the study type. So this is exclude. We press here exclude. Next, transcutaneous vagus nerve stimulation, a brief introduction and overview. Actually, this is also excluded. Why? Because it is a brief introduction overview. It is not RCT, not case control, not prospective or retrospective cohort. So excluded. This is article vagus nerve stimulation paired with rehabilitation for upper limb motor function after ischemic stroke, randomized blinded Beethoven device. Let's look at the abstract. Here the method, as you see, it's RCT, so it is our study type, and it's talk about the intervention, which is a vagus nerve stimulation, and the outcome. Let's look about the rehabilitation paired with stimulation cohort, randomized was our population after ischemic stroke, so it's our population. So, and our outcome also the improvement in the function of the upper limb. So it is population, intervention, and outcomes and study type. So this is included. Here we talk about transcutaneous vagus nerve stimulation in stroke, the evidence, challenges, and future direction. Actually, this is review for a pilot clinical trials of vagus nerve, transcutaneous vagus nerve stimulation. So it is a review, not our type, study type. Here we talk about vagus nerve stimulation ischemic stroke. As you see, it is review also. It's not our study type, so excluded. Vagus nerve stimulation in brain disease, therapeutic application and biological mechanism. It's also review, as you see. And when you read the abstract, you found it is review, so excluded. Non-invasive vagus nerve stimulation in cerebral stroke, current state and future perspectives. So let's look at the abstract, and we should read here carefully about the methodology or study type. Sometimes it's not clear from the abstract, so what can we do? Invasive nature, clinical application, develop non-invasive stimulation. So it's a summary, actually summarize the parameters, advantage, potential mechanism, adverse event of current non-invasive vagus nerve stimulation applicant, future challenges. It's review. But if you are not sure it's excluded or included, you can put maybe, and you can write here your reason or tips for discuss it later with your team. That's maybe it's not clear, it's review, or so on. So after that, some article will be maybe even after we finalize this is screening, There is third independent reviewer also to resolve the conflict of interest. They do meeting together in the team and decide if this is paper included or excluded. Actually, for me, it's excluded, and I just put maybe to show you there is included, excluded, and also maybe if you are not sure it's our or not our population intervention outcome or study type, and even you have another idea to press here on the link and go read the full paper. Okay, here it's narrative review, so from title it's excluded. Here we talk about article review, so it's excluded. Here, efficacy and safety of vagus nerve stimulation of the upper extremity motor function in patient with stroke, meta-analysis of RCT. Here it's meta-analysis, so it's excluded, but it's talk about only the upper extremity motor function. It is different from our study, that our study include all post-stroke dysfunction, and it talk about the efficacy, safety, and the therapeutic efficacy. That's talk about the rehabilitation and improvement in the progression. So this is also excluded. Let's also read it. Here a past review, present and future device excluded. So like this we finalize our screening. We have here in this is the screening 300 article, and another we can also look at the detect duplicate. It's work with Rayyan website, and always I prefer this is way. We have 12 duplicates, so we can document in our Prisma flow diagram. That's the duplicate, it's 12, and we can remove duplicate by EndNote program. I hope this is useful. Thank you for your time and have a nice day. Bye bye.